Dr. Johnston. We are most honoured to have Professor Anthony J. Hedley, Emeritus Professor of the School of Public Health, as our guest of honour. Professor Anthony J. Hedley has been Chair Professor of Community Medicine at HKU since 1988. He was Head of Department of Community Medicine, the forerunner to the School of Public Health, from 1988 to 2000. He is also an Honorary Professor at the 4th Military Medical School in Xi'an and at Khon Kaen University in Thailand. Before coming to Hong Kong, Professor Hedley was the Henry McKeon Professor of Public Health at the University of Glasgow. He trained in the Scottish Medical School of Aberdeen and obtained his medical doctorate by research and a diploma in social medicine from Edinburgh University. He is a member of the Royal College of Physicians in the UK, a Fellow of the Faculty of Public Health, and a Fellow of the Hong Kong Academy of Medicine. Professor Hedley has worked in general medicine, geriatrics, endocrinology and diabetes in the UK before moving into the field of epidemiology and public health. He was responsible, with others, for developing several British health information systems and registries for thyroid disease, diabetes and hypertension. In 1973, he became a lecturer in social and preventive medicine at the University of Aberdeen and a senior registrar in geriatric medicine. He was appointed as a senior lecturer in epidemiology at Nottingham University and an honorary consultant in community medicine. Between 1977 and 1986, he conducted international workshops and surveys for the World Health Organization on the risk approach in maternal and child health in Nottingham, Geneva, Kuala Lumpur, Manila, Fiji, Beijing, and Hanoi. The UK Overseas Development Administration assigned Professor Hedley to Thailand to develop the new Khon Kaen University Health Sciences Centre. In 1983, he was awarded an honorary MD degree presented by His Majesty King Bukpal Adjuje of Thailand. For over 5 decades, Professor Hedley has worked on the development of health services research and the application of the informatics approach to patient care between the primary and secondary healthcare sectors. He was chairman of the Hong Kong Health Services Research Committee Expert Subcommittee on Grant Applications and chairman of the Physiotherapist Board. In recent years, his main research interests and public health advocacy have been in the field of environmental health, spanning indoor and outdoor air pollution and the prevention of disease caused by tobacco, and the assessment of environmental risks, including the measurement of persistent organic pollutants such as dioxins and polychlorobiphenyl compounds in human milk. He was, as member and later chairman of the Hong Kong Council on Smoking Health from 1994 to 2002. He was a member of the Hong Kong Advisory Council on the Environment and the Environment Impact Assessment Subcommittee, and a member of the US Health Effects Institute, the International Scientific Oversight Committee, from 2002 to 2010. In 2006, he became president of the International Society for the Prevention of Tobacco-Induced Disease. In recognition of his long and distinguished service, Professor Hedley was awarded a World Health Organization medal for his outstanding contributions to public health in 1999. And he was also awarded a Bronze Bohemian Star for the Hong Kong SAR in 2000. May I invite Professor Hedley to deliver the address of the guest of honor. Professor Hedley, please.
Ladies and gentlemen. I'm sure that all the kind words that you have heard this afternoon have left you in and will have, again, justifiably, an enormous sense of satisfaction, and so you should. This has been a hard course, and you have worked hard. And I offer my own warm congratulations on this achievement. But now your real work begins, because the school, your teachers, hope and expect that you will now be able to consolidate and deploy this new knowledge and skills as a package in a way that you can deploy for the betterment of this local community and the wider world. What should you make of this? How can you do that? Well, I could say focus on the important things in life. Well, many things are important to us, to our next life. On the other hand, may I humbly suggest that it's time for us to look around and look for new ground. Principally by doing perhaps different things, and certainly by doing things differently. I'm very conscious that this class comprises a very mixed audience. We have here a great number of different backgrounds and disciplines. So how can this be done? This mix and match. One of us, some of us I should say, I hope all of us, may be wondering how we can harness this new set of knowledge and skills, as I said, to the betterment of the community in a way which makes a real difference. Well, there was an English poet, his name was John Betjeman, and he said, don't look downwards, look at the rooftops. Look at the rooftops and see what you see that can be changed, which can be improved. And in so doing, you could challenge yourself, say, how could I have done things differently? Well, you could even start with New Year cards. That's something on perhaps all of our minds. But seriously, if we look at healthcare, we can first choose communication. There is absolutely nothing more important in the widespread collective disciplines of public health, which does not require us to communicate more effectively. And you will be aware, as much as I am, that given the turbulence and indeed disasters of the last few months, an improvement is needed in risk communication. We can deploy those verbal and visual skills which we have and which hopefully we have acquired through our inside knowledge to improve risk communication so that the public can more effectively interpret the relevance of what is going on around them. It might relate to street epidemiology. It will certainly relate to the random and not so random events which dictate what is going to be the next turbulent event, perhaps the next disaster. Wherever you come from, whatever you do, please try and make risk communication one of your priorities. You can look at your practice and the way in which it is run in terms of connectivity. In other words, how we can prevent the fragmentation and the breakdown of continuity of care.